Action.
Hello. Let's talk about infectious disease. Did you ever notice how often some people come down with colds, the flu, sinus infections, ear infections, sore throats, or bronchitis? And other people rarely or never get sick at all. What is the difference between these two groups of people? In a word, it comes down to resistance. The person who gets sick quite often has a low resistance to disease. The person who never gets sick has a high resistance to disease. People often blame the germs, but it is still the fact that both groups of people will be exposed to the same germs, and one group will fall ill while the other group stays well. You see, more important even than the germs we come in contact with is how resistant we are to disease. It is so sad to see someone who is constantly struggling with infection after infection. One of the things that hurts me the most is to see a child getting sick, taking antibiotics, and then soon after stopping the antibiotics, getting sick again, and the cycle repeating itself time and time again. The parent oftentimes does not want to give their child so many medicines, but they don't know what else to do. If they only knew how to help their child have a higher resistance, they would give that child a chance to stay healthy. So what are some of the more important things one must do to have a higher resistance? Certainly they must eat nutritious food. They must get some fresh air and exercise. They must get adequate amounts of rest and have a health-producing mindset. These things are well known, but I must tell you that one other thing is absolutely essential in order for someone to have high resistance. That is, they must have a clear, undistorted nerve supply. You may have heard of the parent who brings their child to the chiropractor at the first sign of a cold or infection. They have good reason to do so. Chiropractors are only concerned with one thing. They adjust to rid the body of subluxations so that normal nerve supply is restored. A subluxation is a bone out of alignment that causes pressure on a nerve which blocks, irritates, or distorts the nerve. It is very common to find subluxations even in infants and very young children. So why is that so important when we are talking about infectious disease? Because modern science is proving what chiropractors knew all along. The immune or disease-fighting system in the body is under the control of the nerve system. Even circulating immune cells, your disease-fighting white blood cells, have been shown to receive messages through the nerves that control their action. Imagine that. Nerves have a powerful influence over circulating white blood cells. No wonder chiropractors have always seen great results helping people to be more resistant to infectious disease. The nerve system controls the immune system. So many people have told me that every year, like clockwork, they would get bronchitis, sinus infections, ear infections, and sore throats. They would go on to say that finally they found help through chiropractic. Remember, adjustments restore normal nerve supply. Since nerve supply is vital to a healthy immune response, chiropractic is one huge step in the right direction for people who want to have high resistance. So get your adjustments and make sure that children get theirs. And don't wait for the first sign of a cold. Keep the nerve supply clear before any problems occur. You and your child may very well become one of those people who rarely or never get sick.